You're staring at your 5-month-old baby, wondering if they're ready for real food. Your mom says start now. Your friend says wait longer. And you're completely confused about what's right. If you're tired of getting mixed advice about when to introduce solid foods, this guide will give you clear answers. I'm sharing the exact signs to look for and the biggest mistakes parents make. By the end of this video, you'll know exactly when your baby is ready for solid foods. You'll understand the warning signs that mean you should wait. This isn't just theory. These are practical steps backed by pediatric experts that will make you feel confident about this milestone. Here's what might shock you. The World Health Organization says wait until 6 months. Not 4 months like your grandmother suggests. Exactly 6 months. At 6 months, your baby's digestive system is mature enough to handle solid foods. Their kidneys can process the extra work. Starting solids before 4 months can actually harm your baby. One study found babies who started before 4 months had triple the risk of respiratory infections. But here's the truth most guides won't tell you. Some babies aren't ready at exactly 6 months. The key is watching your individual baby, not the calendar. Your mother-in-law will pressure you, but guidelines have changed because we know better now. Trust current research over outdated advice. Picture this scene. Your baby sits in their high chair without slumping over. Their head doesn't wobble. This is the first crucial sign. Sitting up with support means their core muscles are strong enough to handle eating safely. The tongue thrust reflex test is critical. Offer your baby soft food. Do they immediately push it out with their tongue? That reflex is still working. Wait another week. When it disappears, food stays in their mouth. This usually happens between 5 and 7 months. Watch for interest signs. Your baby becomes fascinated with your meals. They watch every bite like they're studying for an exam. They reach toward your plate. They grab for your cup. When you bring food near their face, they automatically open their mouth like a baby bird. These behaviors show they're ready to join family meals. Here's something surprising. Your baby's iron stores are almost empty by 6 months. Iron deficiency causes developmental delays. So your first foods must include iron-rich options. Pureed meat, iron-fortified cereal, and well-cooked lentils are excellent choices. Many parents start with fruits, but iron should be the priority. Single-ingredient foods rule the first month. Offer one new food every 3 to 4 days to identify allergies. Honey is absolutely forbidden before 12 months. It can cause serious illness. Cut grapes into quarters. Avoid whole nuts until age 4. Old advice said avoid peanuts and eggs until after age 1. New research completely flipped this. Early introduction actually prevents allergies. The LEAP study showed 80% fewer peanut allergies when introduced early. Mix peanut butter with breast milk and offer small amounts when baby shows readiness. Choose a time when your baby's alert and slightly hungry. Mid-morning after the first milk feed works well. Create a calm environment without distractions. Your baby will probably eat 1 teaspoon in their first session. This is completely normal. They're learning to move food around their mouth and experience new textures. Expect them to play with food. They'll squish it, smear it on their face, and drop pieces. This isn't wasting food, it's learning. The mess means they're developing properly. Week 1-2 expectations should stay very low. Some babies gag as they learn. This is normal unless they're choking. It can take 10 to 15 exposures before babies accept new foods. Know the difference between gagging and choking. Gagging means they make noise and push food forward. Their safety reflex is working. Choking is silent and scary. Their face turns blue and they can't breathe. This needs immediate action. Learn infant CPR before starting solids. If your baby consistently refuses all foods after 8 months, consult your pediatrician. This could indicate developmental delays. Severe allergic reactions include trouble breathing, severe swelling, or loss of consciousness. Call emergency services immediately. Starting solid foods doesn't have to be scary. Wait for readiness signs around 6 months, start with iron-rich foods, and trust your baby's pace. Every mess and rejected bite is progress. Trust your instincts as a parent. If this cleared up your confusion, hit like and subscribe for more parenting advice. Comment with your biggest feeding challenge, I create videos based on your questions. Share this with other confused parents. Next week, I'm covering the biggest feeding mistakes to avoid.